Ayla, welcome to the Gut Honest Truth podcast. This is your very first episode with us, and obviously not your very first day with us. So, anyone who is new to who Ayla is, she is our newest functional medicine nutritionist and practitioner at GHT, but she is not new to me. I always like to tell people that because people always assume we just met, you just came on board. But I have known Ayla for years, professionally and non professionally, and she's wonderful. So, say hi to the people and tell them a little bit about you.
Hi, I'm Ayla. This is my first podcast in a while, so bear with me. But yeah, like Katie said, I've known her for a long time. We met when I first started my career in nutrition. I worked really hard to get this internship that everybody wanted, and
You are the chosen one.
yeah. And I got to work for the infamous Katie Mora. So I was really excited, learned a lot from her, and we actually just grew a really nice friendship out of our, working relationship as well. And then when she went to do her own thing, we stayed friends, and now we're here together. I don't know how much you want to get into those details about
We
about me.
full circled. I think it's important. I do talk a lot. I don't give too many details away ever, but my past, I think that our training, just even the type of work environment we've been in, is really unique to the functional medicine space, whether patients and clients realize that or not, is that we actually have worked for insurance-based functional medicine practices, which are far and few between right now. And really the biggest takeaway as to why I think that's such an important thing to tell people is because we almost worked at a capacity that traditional medicine does in terms of seeing like 10 people a day regularly, versus many functional practices will see like 1 to 3 people a day, right? Because it can be exhausting. Like not everyone, it might be like 1 to 5, but so that's like about 50, sessions a week that you're seeing, which means your clinical skills, your ability to be very quick and effective and know like jumping brain to brain or what, concept to concept test has to be really good. And I really think that is kind of a flex for you for our practices. Like you have seen a lot of people, you've worked through complex cases, you've worked with all sorts of people and situations. And I just think that's really unique.
Yeah. And we're definitely, gained the skill of thinking on our feet and thinking
Hmm.
really quickly, and being able to come up with at least solutions that people can start with. And then after the appointment, being able to think a little bit more through it. But luckily now slowing down,
Yeah.
um,
It's
we,
nice. It's like you get to keep that
yeah.
really high paced thought process, but you get to really spend more quality time with people, how GHT runs, which is
Mhm.
perfect. It's a
Yeah.
good
And
blend,
thinking more
right?
thoroughly about the case and yeah,
Yeah.
keep
And you
diving.
also have a long history of working with a lot of different types of practitioners. So not just nutritionists and RDs, just by trade, you being a CNS, you've worked with MDs, DOs, you've worked with like everything from almost like chiropractors to massage therapists to acupuncturists. So
IV
that's also
nurses.
pretty unique.
Yeah.
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 You've seen it all and you know it can be helpful. So I think that's important for people to know about our team, and tell people a little bit, just kind of whether for fancy words, what's your sort of approach or philosophy when you start to work with clients? How do you sort of approach it, whether it's mentally, emotionally, clinically?
Yeah, definitely want to connect on a person to person level. I like to work more as your, somebody who's partnering with you rather than and providing some guidance and advice and things like that. But I don't want it to ever feel like authoritarian or like
Yeah.
that kind of thing. Um, and initially I really like to get to know somebody and get the history and get to know
Hmm.
what's going on with what you're currently dealing with, but then pulling in other things that may have led up to it as well. We talk about, sometimes even going as far back as like your birth, not every
Hmm.
time, but, childhood, where you've lived. I just had somebody today that we talked about a house she lived in 20 years ago that had mold in it.
Hmm.
So we get to know each other on that level. So sometimes the first appointment you might leave with some testing to do or something as far
Hmm.
as a supplement or dietary change. But the real nitty gritty gets into once we
Yeah.
dive a little bit deeper into the
Yeah.
detail there.
I think it's interesting isn't the right word, but important that you talked about even just mycotoxin exposure and mold in this moment, because I think it highlights too how much we don't just do specific to, like, a lot of what you do to support mold is actually nutrition based, and so, nutraceuticals, botanicals, which actually is more of like a nutrition RD specialist for a lot of people, but that you don't just do food as medicine, right? You actually do quite a lot in terms of like testing, whether it's gut, hormonal, detox. We kind of do it all, with obviously keeping in that you should have a PCP and your specialist, and we want to keep everybody kind of on the same page there. But I do think that's important.
Yeah, yeah. And definitely if we can change or adjust things about food, we will. If there's any certain foods that can help for like particularly if somebody's not eating any cruciferous vegetables, but
Hmm.
they're not detoxing well, then we want to do that if their gut can handle it. But there's definitely more that we
Yeah.
provide, you know.
Yeah, I think that's important. What are some of your favorite, sounds weird to say favorite because they're always negative things, but what are some of your favorite like conditions or symptoms or type of situations and people that you like to work with?
Yeah, yeah. So I do really like to work with the gut, anything candida is kind of fun. I've been diving into more
Mhm.
seeing like systemically as well what that does.
Mhm.
Also I like to work with detox too. So
Mhm.
I like liver detox in particular and making sure your liver is working well. It plays a huge role in hormones, weight loss,
Mhm.
even, histamine type symptoms and detox
Yeah.
symptoms. Your body's always detoxing on its own, but if it's not detoxing properly, then you can come up with some buildup or some symptoms in the bloodstream there. So yeah, those kind of things. I just had MCAS today, mast cell activation syndrome, um,
Mhm.
hormones, those
Yeah.
kind of things.
Yeah. She's also leaving out that she's a big fan of working with preconception through
Uh,
breastfeeding journeys for
that's like a given
she has
for
a
me.
soft I know,
So.
I was like, she has a soft spot for that and she's not,
I,
which is can be so long, right? That could be years before you're thinking about trying to conceive. So like if
yeah,
you are a male or a female in a relationship trying to procreate,
yeah.
this girl's your girl.
Yeah, I
Um
feel like I don't say that because it's like my favorite thing.
I
So like it's a
You're
given for
like
me. So if you don't know
that's
me.
like me being like, "Oh yeah, I work with the gut."
Yeah,
I
yeah,
enjoy it. Yeah, yeah, I like that.
yeah.
Yeah, so lots of things, a little bit of everything.
Mhm.
But as always, I mean, GHT, we do almost everything, but we really do specialize and thrive kind of in the gut hormone detox space as a unit. So, um, which makes almost everything function again. So,
It
if you
definitely
are
helps
in
us feel
need,
better.
yeah, if you're in need, you can learn a little bit more about Ayla on our website, or we are currently, and I'm not sure how long that will last, but offering a complimentary discovery call if you want to get to know her and have her get to know you a little bit better and make sure it's the right fit, which we know it will be. So you can absolutely do that on our website, guthonesttruth.com, and just head to the appointments tab and you'll find your girl there. So anything else you want to tell us about your little niche or your hopes and dreams for the functional medicine world and space?
No, I really do. Like you said, I like working preconception through pregnancy, even if you have
Mhm.
a younger family member who's having irregular periods or seems to be
Mhm.
struggling with heavy menstruation, things like that's a realm
Yeah.
I like to dive deep in.
Yep.
Yeah, I have 3 kids, a
Yeah.
husband.
A
In
husband.
the middle of
Um,
nowhere.
she has 3 beautiful children. They're like spitting images. Um, so yeah, she knows. Do you work with children?
Yes, I can. So definitely
We do,
on a case
yeah.
by case basis.
Mhm.
We could discuss, but yeah, I've worked with pediatrics
Yeah.
as well.
Yeah, I always tell people with the peds, we don't specialize in pediatrics, but you and I specifically will and do work with children. And just to, I would prefer in that situation, you do actually use our contact form and just kind of give us a little bit more information so we can sure it's something that is a proper fit or that you don't, and or we can refer you out to one of our colleagues that maybe takes on more pediatrics, but always use that contact form, people. I feel like people are shy about it and we love to hear from you and make sure, we if we're not it, we'll get you to the right people, hopefully. So That's awesome. I think what we're going to do today, guys, is we're going to do a little bit of a Spitfire as Ayla's icebreaker to the podcast world and GHT. So we're going to do a shorter version of our Spitfire round and ask each other, if you will, some questions that you guys have submitted and give us kind of our raw answers to hopefully guide you or to see if we can be of more service to you in actual sessions. So Ayla, I'm going to let you ask. I'm going to let you be the narrator of the story today. Throw things
Okay.
out there.
And then I'll just add in my input
Mm.
as needed. Okay, cool.
As needed.
Uh,
We want to hear your thoughts.
okay, what are your favorite supplements that are safe for pregnancy?
Oh gosh. I'm
Relevant.
pretty, yeah, I will say I am when it comes to pregnancy, a little bit more stand backish. Like I won't do too much. That's just I don't, that I'll just preface with that. But generally speaking, for most people, please do not just start taking things without talking to your provider, or we can do a supplement consultation with you. Always, obviously, a really good prenatal. Some kind of DHA or fish oil concept if you want. They have prenatal DHAs to make sure you're getting enough for baby's brain. So those are kind of like your basics, depending on your needs and time of year and other things you want to think about, maybe some vitamin D, depending on how much is in that prenatal. I almost always put people on choline of some sort. There isn't enough choline in your multivitamin. There's like one or two products out there right now that probably have what you need, but just so you know, something called choline is really, you can get it through food too. You can get a good amount through eggs, but there's a good period of time where eggs might disgust you when you are pregnant. So you might be wanting to get it through supplement form. And it can be both really good for mom and baby in terms of gallbladder support, liver support, gut support, but also obviously for neurological brain development and everything for the baby. So your needs go significantly up. And then they go even further up if you decide to breastfeed. So it's kind of one of those prep products I'll put people on and keep them on if they're tolerating it kind of like ongoingly. I'm trying to make sure I'm not missing any, but like those three, and then the rest sort of like depends on the person a little bit. Like, do I think
Yeah,
you need some magnesium? Is it a different part where maybe some calcium? Like it just really depends. But
there's super individual circumstances. Like, do you need digestive support that's safe? You
yeah.
know, do
Yeah.
you need extra folate for different mutations?
Yeah.
Potentially, do you need extra iron?
Well, we're just going to preface she meant genetic mutations,
Okay.
not fetal development mutations. We'll clarify that one. But yeah, it's just it
Yeah.
depends, not always. But I would say those are my three. Do you have any others that you'd add to like your foundational?
Yeah, no, those are the main ones. Maybe a probiotic, in some cases, maybe not,
Yeah.
it all depends. So, but those three are, yeah, the prenatal, the fish oil, and the choline
Mm-hmm.
they're my main
Yeah.
ones.
Yeah. Glad we're on the same page. Okay. Good question.
Oh, next one. My doctor prescribed Florastor for me, but it's over the counter. Is it helpful? This isn't refrigerated.
Yeah. So Florastor for anybody that might be more, in the functional space is actually just Saccharomyces boulardii, which is, we'll call it a probiotic for this conversation. If you need to learn more about probiotics, definitely go on our blog. We have an entire article about probiotics, including Saccharomyces. But Saccharomyces boulardii does not need to be refrigerated. So don't stress about that component unless it's in a product that everything else needs to be refrigerated, and then the product should say so. But that's all it is. It's over-the-counter Saccharomyces boulardii. We refer to this really as like yeast fighting yeast, but it can be really helpful for many other things like H. pylori, dysbiosis, immune function in the gut. There's quite a lot of things. So, yes, it is safe and it can be helpful. It's not the one I use off the top of my head specifically, but you absolutely can use it. I have to look up the dose of that to even know
I think
effectiveness,
well,
though.
it might be three.
It's as I said, not the one I use off the top of my head. Um,
Expensive too, I think.
yeah, so there's it might take me a minute to find the dosage here. It's 500 milligrams,
Okay.
but it's in 2 capsules. So yeah, if you're someone who doesn't want a lot of capsules, there's definitely other products out there, but I don't know if you have something to add negative?
No, I usually prescribe, I find one that's at least 500 milligrams and then
Hmm.
maybe more sometimes, but
Yeah.
usually
Hmm.
I feel like you can usually find it cheaper in other
Yeah.
brands.
Yeah. But if it's a good one if you don't have somebody guiding you, and access to other supplements and all
Yeah.
of that. But yeah.
Yeah, it's not a bad one. I actually recommended somebody want that today because, waiting for full scripts, get to the store now.
Yeah. Yep.
It's- yeah. So next question.
We're ready.
How do I fix my metabolism?
You schedule an initial consultation with Ayla Hepting. um, oh gosh, we definitely have some blogs too, free resources on metabolism. And actually, we just put one together today that will come out this year on kind of like tips and tricks without it being a fad behind weight loss support and stuff like that. Um, we used to run this whole like metabolic panel that we had as like a package offering, but there's quite a lot of things that you can look at. But the bigger thing is you need to be really digging to root cause. Like sometimes if you've worked with nutritionists or you've tried so many different approaches with food, right? And food is medicine, nothing's shifting. Like you really need to be getting some labs drawn, working on hormonal function, checking your thyroid, looking at insulin. There's so many different things that can be wrong. And I think we're so quick to think like metabolic function, healthy weight and body composition, like fitness and nutrition, and that's it. And it goes so much deeper, whether it's toxic burden, stress levels and how you're managing them, sleep patterns. Like we can just keep diving layers deeper. So I really do recommend you actually work with a functional medicine nutritionist on that.
Yeah, and liver detox is so important because
Hmm.
your body is not going to release fat cells if you're not detoxing the toxins that are stored there properly. You don't want
No.
them floating around too long in your blood. So that can be one major cause of weight loss resistance.
Or if
Um,
you're somebody who does similar concept, like I'm going to call it fad dieting. It's not always, but like these more aggressive diet plans to lose a lot of weight really fast, like you are going to release more toxins into the bloodstream. And if your body is having these detox inabilities that Ayla's referring to a couple of times now, it potentially is going to impact your thyroid function. And then your thyroid's going to get slowed down, which is then going to further put you into weight loss resistance. So that's another, if you're like somebody who keeps hitting plateaus, like you lose like 10 pounds and you're hitting a plateau, that might be why.
yep, yep, definitely. Yes. Anything else to add to that?
Like 100 things, but it's
Yeah.
so specific. You know what I mean? That one's so
Yeah.
specific to somebody that just know there's so much more you can do and your metabolism isn't broken. You're just not doing the things you specifically need to support that, upregulation of it,
And don't chronically undereat to lose weight. That's not the way.
or
That could be more
overexercise.
harm.
Yeah.
Yeah, yeah,
No.
more harm than
Nope.
good.
Good point.
Okay. So, how do you navigate the all or nothing restrictive mentality of functional medicine? It can be really overwhelming.
You don't go to all or nothing practitioners first and foremost. So like I always say, I'm like, God, I feel like I couldn't be more trained and certified as a functional practitioner at this point. But like I sit in such a gray area. Like I am a traditionally trained practitioner that then did extensive training in the functional space. And now I train others in the functional space. But like I always ensure in my trainings, like I'm teaching you kind of this gray area for a lot of things because it shouldn't be all or nothing for a majority of concepts, right? Like it shouldn't. Yeah, there's absolutely situations where like let's just pretend you're like you can't have gluten for the rest of your life or you shouldn't have gluten for this long. I'm just gluten tends to be one of those things everyone will probably relate to on this podcast, but things like that or like processed foods or eating out or whatever it is, you know what I mean? Um so I would say first of all, if you're on social media, unfollow people that seem all or nothing and are causing stress to you. Two, find a practitioner that a little bit sits more in the gray area and not like if they're putting you on an extremely restrictive diet on day one before they know anything about you, unless you've agreed, like sometimes I'll do like an elimination diet just because it is a good amount of time between testing. But the whole intention of that is to put the food back in like 1 month. But if they're like, we're going to go on AIP for 6 months, we have no labs on you, like that, don't leave. Yeah, leave. So that's my initial gut reaction.
Yeah. If they have any like rigid ideas about diet, like keto is the only way you're gonna ever
Hmm.
heal, or
Hmm.
I can't think of specific reasons, but you have everybody from veganism to carnivore to, everything
Hmm.
in between where people have these like rigid ideas that this is the only way you're going to heal your autoimmunity or your gut symptoms or something like that. Whereas everybody's so individual, if the practitioner doesn't get to know you first, that's a red
Hmm.
flag, you
Hmm.
know?
I'd also say this will take longer of you, unfortunately, working with someone to sometimes spot, or you maybe don't know how to spot it because you're putting trust in a clinician or a coach. But people who do a lot of like cookie cutter type of protocols or even cutter type of testing, like you sign up and this is what you get. Some of it is inexperience and like naive thought processes behind the practitioner. They don't actually know everything. And then again, is that really who you want to be working with? Because they're just like, I think if I like, remember early on, it would be like, you fix the gut, you'll fix autoimmunity. And you're like, that's not how that works. Like, so like people who can't see outside of that, they're going to have rigid beliefs because it's all they've ever been trained on and know. And like, if they're like, here's 20 products, this is what you need to do it for this long. And like, this is a 3-month program, they're going to be rigid because they have their own cookie cutter protocol for 3 to 6 months, and there's not much they're doing to make it specific to you. I don't want to put every practitioner and coach in that,
Right.
pocket of thought, but it's pretty common these days.
Yeah, a couple of thoughts I have with that is like one that comes from often like overwhelmed and overworked practitioners
Hmm.
where they're like, okay, we just need a
Hmm.
protocol. We need something that works for most people and then
Hmm.
adjust as needed. And then the other thought is if there is like this protocol and your practitioner, or you can even ask your practitioner this and be like, this is tentative, right? Like things might
Hmm.
change based off of my reaction to things or how I'm doing and stuff like that. If
Hmm.
this is not a tentative protocol, that's a red flag too,
Yeah.
in my opinion.
I will say though, to just stand up for some practitioners, sorry to all of the patients out there I've ever worked with, but like some of that comes from the pressure of the client or the patient because we still, unfortunately, and this isn't everyone, and hopefully it will keep shifting. A lot of functional medicine seekers, right, still want that magic pill. They still want the quick fix, which is like the opposite of what functional medicine is. And it's sort of like a pressure on, especially newer clinicians or newer businesses, you know what I mean? That is like, we have to have a protocol and it has to be for this long. And this is exactly what we do because otherwise people freak out and they think you're just kind of winging it. I'm kind of putting words in people's mouths, but I see it all the time. You know what I mean? I do see it all the time. And people being like, this is going to work, right? And you're like, no one said amoxicillin is going to 100% work either for your infection, right? Like we have to try something and then pivot based on you specifically if we ever have to pivot at all, right?
Yeah. And I think partially like to go back and forth on that to back to like practitioners, sometimes the more like big,
Mm.
well-known practitioners in the functional field make it feel like it's the end all be all of medicine
Yes.
and the magic
Again,
pill.
get off
So
social media.
it puts a lot of pressure on the like people out in the field,
Hmm.
the
It
trenches
does.
doing this. Yeah.
It does. It does. It's a tough place to be right now to really have that like as a clinician. Well, it's a tough place to be a patient and have that trust and that investment into the functional space. And it's a tough place as a clinician to have like the direction and confidence and experience and all that. Cause like now everybody has their own business and they're not being mentored properly. They're not working for people because it's so easy to do these online practices, which is great. As you know me, I support all the people wanting to do their own thing. But um, we should we have a whole podcast episode where we like banter the patient thought for the
Yeah,
practitioner
I
thought?
think that would
That
be
could
great.
be fun.
These are conversations that are hard to have directly with
Yes.
clients, right? So I think if we have like a back and forth on that, that would be good for both
Hmm.
other practitioners and
Yeah.
clients to see like what do these conversations look like and
Yeah. And many of us in the functional space have been the client too, right? Like we've been there
yeah,
and like,
I currently are sometimes. Yeah.
yeah, I have so many. I feel like I'm a good brain to have in that kind of episode because I do feel like a lot of times I'm like I step away from the practitioner piece and I can see it and just be like, this is exactly what's going through their brain. You know what I mean? Their brain and why it's so hard and so frustrating. And like, especially with social media now and blogs and all that. So yeah, we'll jump on that, guys. That's a good future one.
Yeah, that'll be good. Are we ready for the next
We
question?
are.
My husband's testosterone is low. He's working on his cortisol and his gut is with a functional and his gut health with a functional medicine doctor. But what other things supplements should he take?
I'm not going to tell him to take anything because I'm not his practitioner, but you could talk to his practitioner about some things like even just something thinking based on like the cortisol conversation, like ashwagandha could be a good thing to bring up to the practitioner in terms of kind of pumping up testosterone and also helping with cortisol balance potentially. Um, what ones are coming right to your brain as you think through that?
Um, there's a lot of things like stress relief. I don't know, like maybe what his
Exercise.
weight
Yeah.
situation, yeah,
Yeah.
body fat situation is, even age.
Yeah.
Um, so there's a
Yeah.
lot of factors at play in low testosterone.
Hmm.
Does he have a history of taking exogenous testosterone? Um, that's
I was
not
going to
usually
say
the case, but I
maybe.
always ask that. Yeah.
Yeah. Yeah. And I was going to say maybe the estrogen conversation, like, is there a conversion problem between testosterone and estrogen? And again, just kind of going, circling back to when Ayla was talking about body composition, like, is there too much belly fat? Are we skinny fat? Like, what is going on
How
there?
colorfully, yeah, lots of
Yeah.
them.
Lots of specific exercise and stuff like that can be helpful. But yeah, I mean, talk to your practitioner. There are some supplements out there, but I would initially want to see the whole hormone pattern, and I would want to see the lifestyle across the board
You might
pattern.
already be doing this, like a basic, good quality though, multivitamin could be a
Yeah.
good place to start, fish oil, that kind of stuff.
Yep. Some zinc. Yeah. Yeah.
Yeah,
More to
yeah,
talk about with your clinician.
yeah. I've heard melatonin can be good for the esophagus.
Mm.
Is that true?
I wouldn't indirectly, yes. I wouldn't say it's good for the esophagus. It's good for the lower esophageal sphincter. So that is the little open close thing, if you will, that is between your esophagus and your stomach. So, right when food goes through, it's open so the food can get into the stomach and then it should shut. What a lot of people have is like faulty valves, faulty sphincters, loose, where they have connective tissue disorder, they have hernia, something, a built up pressure that's like causing it to stay faulty open. So, essentially, if you have a loose sphincter, you're potentially going to experience more reflux, indigestion, Barrett's esophagus, all these different problems that seem like esophageal problems, but they might be sphincter stomach related. So it's research has shown that you can take up to, please talk to your practitioners, but up to 10 milligrams of melatonin per day to actually help strengthen over time the lower esophageal sphincter. So we use this a lot with acid reflux patients.
Yep,
Yes. So yes and no to that question.
a good one. I was told I need a SIBO test, but I've heard that it can be off if you have loose stools. What should I do?
That's a great question because you do see this a lot happen in practice. Is that so? First of all, SIBO testing, SIBO, small intestinal bacterial overgrowth, is looking really at again bacterial overgrowth in the wrong organ, the small intestine, where we're talking about the microbiome. We're usually referring to there being trillions of bacteria in your large intestine. So there's a SIBO test. It's a breath test that you do at home. I'm not going to get into too much detail unless we want to, but there's different types of tests. There's different scenarios that use them in diagnoses. But if you're exhibiting symptoms, so somebody who maybe is having, like this person, loose stool, diarrhea, they might have IBS-D, right? IBS diarrhea, bloating, gas, all the things. They might say, sounds like, you're doing this 2 to 3 hours after meals. We should get a SIBO test on you. But the problem is for people, if you're using, and this is kind of more information than many of you need right now, but there's like a glucose test and a lactulose test. If you are looking, most people, doctors will use a lactulose test. Lactulose will act as a laxative. There's a lot of axes there. Lactulose will act as a laxative. So what that means is if it potentially is going through the GI system too quickly, the transit is too fast, it could potentially feed the colonic bacteria and cause a false elevation on your SIBO test, diagnosing you with SIBO. So if you already have fast transit, aka loose frequent stools, that test probably isn't the right one for you right now. Was one day could you do it? Yeah. But you're probably gonna have a positive no matter what. And like that just depends on the clinician and the patient and like are they going to adhere and like just blindly accept that diagnosis and run with it because that can be a scary path for both the practitioner and client for like years to come. You might do better off with like a glucose test versus a lactulose there, but I teach a whole course on this, so I could keep going for like forever, but that's my generalities is like might not be the best thing. You might want to start with a stool test.
Yeah, that's a good one. I don't I don't like this next question.
Sorry, guys. What is it?
If you could list 10 foods you wanted every
Oh
human
God.
to have, what would it be? What would they be?
It would probably be whatever
I'm
10
not
foods
laughing
are
at the
most.
question, I'm laughing at my thought process.
I honestly, I don't care. I'd say whatever are the 10 foods you love the most in the world. I hope you can have, that
Okay.
would probably be see, this is what I mean, work with a gray area practitioner. So if you're not having the 10 foods, whether it's, no one said daily, does it say daily or is like period?
It
Because maybe
doesn't
not.
specify daily, so it could just be like
If it's
rotated
daily,
where.
like chocolate cake might not be the answer here. But
Yeah.
like if we're talking about like that should be incorporated in your diet, like you're gonna have a really hard life if you're not eating the 10 foods you love the most. Other than that, I have there is no structure or science behind anything
Just
that's about
water
to.
count.
I'm just gonna go with gut reaction. Let's see. I'm not gonna get. Do I even know 10 foods? I'm gonna go with probably. I feel like there'd be like 2 berries on that list, right? Like I don't know, at least a berry. And I'm not gonna sit here and say blueberries because I feel like everyone like I'll eat all the berries. Like I would pick blackberries personally over a blueberry. So, um, I would throw a couple cruciferous guys in there or like some onions, garlic situation would be probably in that plan for somebody. Fish, let's throw fish. Let's throw steak. Doesn't have to be
Yeah.
steak, but red meat.
Yeah.
Um, we're just people are hating this right now. I'm like red meat. What I
Yeah.
do have
Eggs.
eggs. Yeah, I
Mhm.
would throw so we're on the same page. We're gonna do red meat, fish, egg. Mediterranean diet is what I'm listing, right? Berries. I feel like just for happiness, you should have a melon in there because why the heck wouldn't you want a melon in there?
Some
I'm
kind of
not talking.
chocolate.
This would mean I'm not even talking nutrition at this point. I'm just like it's healthy and it's delicious, and you'll eat more fruit. What
Culinary
else we
herb.
got? I'm gonna
It
leave
would be
those out
different.
because it's like you're not thriving on the herbs. The herbs are there to benefit your health and stuff, but like you'd better be satiated with those foods first.
And
Maybe some
taste.
salt. Can put
Of
salt.
salt. Does that count as a food?
I'm gonna
In
salt
general?
is an entire food group. I don't
I'm
know.
gonna go out on a limb, and you might disagree, but I'm gonna say organ
I
meats.
knew you were gonna say that. I haven't worked together in years, and I still knew she was gonna say that. I
They're
wouldn't put it, but not because I disagree. I feel I want you to give your thoughts. I interrupted you. I just was gonna say I feel like it's not and you can, you know what I mean? Come at me for this. I don't even care. I feel like it's not as easily likable or attainable for a lot of people. You know what I mean? Like as it is other meats, but I understand the benefits. So I'm not disagreeing on the reasons you're going to say why,
Yeah,
if
so I
that
think
makes
they can
sense.
be super helpful, especially like I come from like the preconception, like
Yeah.
really, let's really nourish you
Hmm.
mindset. So they're like jam-packed with vitamins, minerals, things like that.
Yeah.
But I can help you make them taste better. I
Yeah.
can tell you how to sneak them in. I just fed my kids spaghetti with meat sauce and I blended the liver. I mixed it in the meat sauce. They couldn't even tell. And
Yeah.
it's not like you're not eating a whole liver. You're not eating like even, you're having a little bit in there, kind of like
Yeah.
supplement.
Yeah.
So,
Yeah, I don't disagree with what you're saying. I'm just like, it's not going to be my top 10 guys. Like for me specifically. Um, no, it's interesting, which we could have a whole conversation on, is like neither one of us has yet to list a carbohydrate, like directly, not talking fruit and veggies, but like a starch, which is so functional medicine right now that it's bothering me. And it's like most people need carbohydrate of some, you know what I mean, some capacity and happiness. So like I feel like we should include one.
and potatoes. There's really good research behind the
Yeah.
resistance starch in cooked and cooled potatoes, and then also the bugs in our gut that make serotonin feed off of potatoes. So,
Yeah. You all get a
maybe not too
potato with
fried.
your liver
Yeah.
steaks and your onion, liver, onions, and potato.
Yeah, do what your grandma did.
I could do this question for like an entire episode, just name things, but throw something in there that you guys like too. Don't feel like we're just naming what maybe is like the biggest bang for your buck without
Yeah.
restriction. Yeah.
And then everybody's different and your time of life is different and your condition that you're dealing with is different. So there might be
Yeah.
different foods that are more helpful for different times of your life.
I'd probably throw some olive oil in there too.
Oh yeah, olive oil.
Hmm.
Forgot about that
Hmm.
one.
That feels like 10. We did a good job.
Avocado.
Yeah. Yeah.
I
Maybe
like
just avocado and not. Yeah.
yeah.
Yep. I'm here
All
for
right,
it.
ready? We have a list of questions here. That's why I'm reading terribly. Okay. I'm new to functional medicine. What are the main takeaways I should be considering?
As a client or as a practitioner? Hmm.
Actually, it doesn't specify.
Okay. Well, if you're a practitioner, you should come train with me at GHT Academy, and I will give you everything you need to know. If you're a
Great.
client, which I'm assuming they are, first of all, we have a what like why functional medicine blog. Definitely read it because it's a good one and talks about like really what it is and the purpose and like how to find clinicians, all the things. Um, again on guthonestTruth.com. So ask me the question again now that I've said that.
I'm new to functional medicine. What are the main takeaways I should be considering?
I feel like my answer is going to be different than people's answers. I'm again just going with gut here. But so, first of all, I wasn't even going to say this, but functional medicine is just root cause medicine. So it's really just kind of the way I always want to specify this because people think it's its own like entity of medicine and practice. Like, yes, we use different tests, but we also use the same tests as many traditional and allopathic care people. But it's really how we actually like listen and hear a patient's case and put it together. We connect the dots so nothing is siloed. And we're really saying, like, okay, of course your liver function is connected to your gut function, which is connected to your thyroid function. And we want to see all those moving pieces so we can make specific root cause plans, if you will, for you to get from sick to healing to thriving. So that's really what functional medicine is like the way you address a patient. Um, so that being said, I would say that like the biggest takeaways are I have like 100 things I want to say. Um, it should be very individualized. Again, talking like cookie cutter everything. Like it should be personalized tests, personalized, if you're even using tests, personalized nutrition plan, personalized supplement plan, personalized medication plan. Like it shouldn't be sign up for, like, I'm not saying there's something wrong with this in terms of starting, but like for my package that has these two specific tests and everybody's going to get better because everything revolves around the gut. Like, yeah, you're going to help most people because most things do start and end with the gut, but like it should be like, let's do an initial intake and some sort, and let's walk through what is going on with Ayla specifically. So I can be like, this is the best way to use your time, money, energy, like everything to heal you, not just because it worked for 12 of your friends and neighbors. Right. So that's kind of like the first few things. I have 100 other things, so you can feel free to add.
Yeah, and yeah, for example, if somebody, asks me how to explain it, it's kind of like, well, if you go and there is a big need for conventional medicine, and if you
Mhm.
have an issue that you need to address immediately, yes, go there, for example, my
Mhm.
my example is I have acne. I go
Yeah.
to my regular doctor and they give me acne cream or whatever. And then sure, that might be a good situation for now. And then, but if you came to us or another functional medicine provider and said the same thing, we'd be like, okay, well, these are some of the reasons you could be having it. Let's dive into, maybe look at your gut and your hormones and things like that. And then ask you deep dive questions about to kind of get a priority of
Mhm.
where we want to start and where we want to test and see why you have acne.
Yeah.
Um, yeah.
And I would say we use a lot of, not always though. This is why we are not anti-allopathic and traditional care at all. We just, and I'm talking GHT specifically because there's obviously definitely some of that out there, but it shouldn't be a this or that. It should be that traditional and allopathic care is for acute and emergency issues. And that when there's things that become chronic, we don't have the toolkit in our traditional settings to really handle 90% of that. So like that's where functional medicine really thrives. You shouldn't be like, I have a urinary tract infection. Let me go to a functional medicine person. Like if they're your doctor too, good. But like you should probably be going and seeing if you need a medication or any other testing. Um, But if you're like, I'm always getting urinary tract infections, like I get like 10 a year, that's where a functional medicine person can be helpful, because they're going to say, well, what the heck is going on with your hormones, your gut, your sexual health, whatever it is, to say, this is why you are super, like extremely exposed and having these recurrent urinary tract infections, right? So that's a good example of like where you maybe would shift, right? Um, and we use a lot of natural approaches, but I also, again, don't think that medication shouldn't be a part of people's plans if appropriate. Like there is some, not is some efficacy, but there's definitely efficacy for things. Or some people might just do better with, like I always think of like yeast. Like some people might do better with something like a diflucan for a couple of weeks that only goes for fungal infections versus using oregano that's going to kill viruses, fungus, parasites, bacteria, and cause them to be way sicker. Potentially, not always. We use oregano all the time, but
Yeah.
do you know what I mean? Like it might be the right approach for you. So I could talk about this topic forever. Yeah.
Yep. Yep. I
Yeah.
totally agree.
Yep.
All
Read the
right.
blog.
um, sorry, I'm just getting my bearings. Are rifaximin or herbal protocols more effective? Talking about.
Depends on the herbal protocols. Yeah. So first and foremost, this is rifaximin, or also known as Xifaxan, is a antibacterial medication that is used for people who have irritable bowel syndrome, diarrhea, and or you might have hydrogen dominant SIBO in the functional space. I like rifaximin. Again, I think it's very effective. I do not prescribe medication, so I don't currently use that unless I'm referring you to your practitioner and saying, let's talk about it. It can be really helpful, especially if you have somebody who's like, not going to comply to 12 plus weeks of herbal products, or um, maybe is so like quality of life is so poor that they kind of do need that more immediate fix. Like there's a time and a place for the medication. Research shows that herbals can be as or more effective if you have the right herbals for at the right dosage for the right period of time in the right SIBO IBSD setting, right? So I teach about this in GHT Academy a lot, but it's similar like when we talk H. pylori even, right? Like the herbal approaches have been found to be as or more effective than a lot of antibiotics at this point. So I like both.
Yeah. Yeah. Same.
Sometimes we use both, you
Yeah.
know?
Like you said, certain situations call for the medication versus the
Mhm.
herbs. We
And
usually
don't
follow
feel, sorry, go
medication with
ahead.
herbs anyway. So
And say you could do just because let's say somebody your practitioners had you do like 10 weeks of herbs and they're not doing anything, like you shouldn't be ashamed to try the medication.
yeah.
It's a pretty safe and effective medication, and it, like, I don't remember the exact percentage, but it's like 98% stays in the gut and doesn't have that whole systemic effect that other antibiotics do have. So I like it.
Yeah. Great. Are PPIs bad for you?
I really wanted to just go, yes. Yes. No, again, I'll always say it depends, right? Like let's pretend you are I don't know. We're going to pretend you got exposed to H. pylori and you don't know it, and you're having extreme reflux, and or a family history of esophageal or throat cancer or something. Like, no, in a short-term situation while you're trying to figure out what else is going on. But the big thing, I teach a lot both in my like ebook, and I'm doing a whole lecture right now on PPIs actually. But it so depends, like, right, majority of people, like a very high majority of people should be only taking a PPI for like 2 to 8 weeks max, right? And it says it on the box. Yet what happens? We have no tools whatsoever in our traditional world to really get to the root cause of a lot of acid reflux besides saying here's a PPI and just keep having more doses or more medications added on if at 4 to 6 weeks it hasn't calmed itself, right? And the endoscopy is clear. And then we actually have this whole situation where people try to get off of it after those like 4 to 6 weeks or however long, maybe longer, because no one ever told them to really come back. And we get something called rebound acid hypersecretion, which is actually where for long story short, like you start to produce almost more stomach acid and higher levels of acidity than you did prior to starting the medication when you actually try to come off or pull out your PPI, which leads to this whole inappropriate, prescribing of doubling of medications. So I could talk about this one forever too. So like, no, there's definitely situations where it's like, it might just be best to calm things. Or if you're currently have Barrett's esophagus or you have EOE and it's helpful for while you're working through some stuff, but a majority of people do not need them. And a majority of people are inappropriately prescribed them and not given any support until they find someone like me that gets them off of them and fixes the underlying problems.
Yep. Yep. Great answer.
So yeah, we'll be
Something that was
respectful and
made,
say, it depends.
yeah, something that was made for short term ended up as a long term drug,
Yeah.
basically. Yeah.
Yeah.
Uh,
Yeah.
can you be put on HCl long term,
You
or can you
can.
keep on it long term?
So HCl is betaine hydrochloric acid. This is funny that we have them back to back. It's like the opposite, right? It's actually giving you external source of what you create internally for acid in the stomach. Really widely used in the functional medicine arena. You can, but major majority of people shouldn't need to be. The people who would need to be are going to be probably, I'm just kind of throwing things out there, but the two subsets of individuals are going to be elderly people, like, anyone like, we'll just pretend, I don't even want to say this is elderly, but I'm going to take back elderly, like 65 and up, I'm going to say as a generality. I really am making an age up, but like, if you are of our older individuals, you might need it, and age is one of the biggest risk factors of low stomach acid. And I feel like we leave that out in functional medicine conversations, that it's like, if you're a 75-year-old, you're not going to do a Betaine HCl test and it's going to like keep reducing. You're probably going to need some support in some capacity forever, potentially. And the other one is going to be people with atrophic gastritis or pernicious anemia, unless we can somehow fix that, you know what I mean, and get to a root cause, like you're gonna need stomach acid support. Was that the question? Yeah, you shouldn't need to be long-term on it. It should be a supportive mechanism to get you like healing and back until your body is doing what it should do again.
Yeah, that's one thing that I try to be more clear about when I'm explaining it to clients is, oh, this isn't forever. I know it feels like forever, and
I
you're
know.
on X amount of pills every single meal for this, but our goal is to get you off
Yeah.
eventually.
And
But
some
then,
people it's super fast, right? Like you have like a 25-year-old client that's really healthy and you can fix their H. pylori. It might be like a week or two that they're on it, you know what I mean? And some people it can be months or a year. It really depends. But no, you shouldn't have to be on like most things supplementally or medication forever,
yes, yeah,
depending,
that's our
depending
goal.
on, yeah, yeah, within reason. So yeah, those are good questions. Are we
Yeah.
done? Have we hit
Yeah,
our
do you want me
quota?
to keep going?
I think we got to save so we got to pace ourselves, guys. So, as always, if you would like to ask your question or submit for our Spitfire, feel free to use the contact form on our website or email us info@guthonest.truth.com, and we will add you to our queue of questions for our next recording that I see we already have a list of questions for. Um, but yeah, you ask, we answer, we don't hold back, as you can see, and we kind of just give you the blunt science, hopefully backed minus our 10 food choices, responses. And as always, thank you, Ayla, for joining us today. And you will hopefully all be hearing and seeing from her much more moving forward.
Thank you for having me.